Assalamu alaikum everyone. I hope all of you are doing well. In this video, I am going to differentiate between type 1 diabetes mellitus and type 2 diabetes mellitus. In both type 1 and type 2 diabetes mellitus, the glucose level become raised in the blood. So this is common in type 1 and type 2 diabetes mellitus. The mode of developing of type 1 diabetes and type 2 diabetes mellitus are different, and the age in which the type 1 and type 2 develop are different. So going to the differentiating point between the type 1 and type 2 diabetes mellitus, you can see over here the type 1 diabetes mellitus is autoimmune disease. It developed due to autoimmune condition. It developed due to autoimmune condition, and it is not autoimmune disease. So therefore the type 1 diabetes is also called autoimmune diabetes. So the second differentiating point is the it can be diagnosed at any age, but is often diagnosed in young children or teenagers. So the type 1 diabetes mellitus can develop it in any age, but mostly it develop in young children or teenager. So the another name for type 1 diabetes mellitus is juvenile diabetes mellitus because it developed in young age. So the another representative point is it develop rapidly. The type 1 diabetes, whenever there is autoimmune destruction of the beta cells of the pancreas, the type 1 diabetes will develop, and it develops slowly because the resistance to the insulin develops slowly. So the fourth differentiating point is there is immediate need for insulin, because in type 1 diabetes mellitus the beta cell become destroyed and there are no cell left to produce insulin. So the type 1 diabetes mellitus then treated through insulin. 2 diabetes mellitus and the type 2 diabetes mellitus, there is resistance developed to the effect of insulin. So can utilize other medication instead of or in addition to insulin. So in type 2 diabetes mellitus, the patient can use medication, and the patient can use insulin. Now in type 1 diabetes mellitus, the patient is dependent upon insulin. Therefore, the other name for type 1 diabetes mellitus is insulin dependent diabetes mellitus. IDDM, insulin dependent diabetes mellitus. So the fifth differentiating point is can be deadly if not caught in time. If the patient is not diagnosed on time, the can be proved deadly. So the patient should be diagnosed as early as possible. Now there is another differentiating point between the type 1 diabetes mellitus and type 2 diabetes mellitus. In type 1 mellitus, the patient develop diabetic ketoacidosis, while in type 2 diabetes mellitus, the patient mostly not develop diabetic ketoacidosis because there is no ketone production in the presence of insulin. While in type 1 diabetes mellitus, the insulin is not there, so the ketone can be produced in the body. So this was all about on type 1 and type 2 diabetes mellitus. For more videos, subscribe, like and share, and keep watching my channel videos. So thanks for watching the video.